Assalamualaikum warahmatullahi wabarakatuh. Greetings to Nurliana and all of my friends. We are from Group 1 EFNB and here's our health promotion about dengue fever. Happy watching! Assalamualaikum warahmatullahi wabarakatuh. Hi guys, my name is Choirunnisaa Wardhani and my NPM number is 21066328882. And in this first section, I will explain about the introduction of what is dengue fever and then epidemiology, which conclude where and how it spreads. First of all, what is dengue fever? Dengue fever is a viral infection disease similar to serious cases of flu and generally spread in tropical or subtropical areas. This disease is caused by the dengue virus, which is mainly carried by the Aedes genus mosquitoes such as Aedes aegypti and albopictus. When the mosquito bites healthy individuals, it transfers the dengue virus into the human body for causing infection. Its course begins abruptly after an incubation period of 5 until 7 days and is followed by 3 phases which include febrile, critical, and recovery phases. The symptoms will occur about 10 days after mosquito bite. The next topic is where and how it spreads. One modeling estimate indicates 390 million dengue virus infection per year, with 10,000 cases led to death because of a dengue hemorrhagic fever. Areas that are risk for this disease are Southeast Asia, the Western Pacific Island, Latin America, and Caribbean.
Hello, Assalamualaikum warahmatullahi wabarakatuh. My name is Diah Nurliana Permata Sari. Next, I will discuss the causes and risk factor of the dengue virus. The virus responsibility for causing dengue is called dengue virus or dengue. This virus develops in the digestive tract of the Aedes aegypti mosquito and enters the human body through mosquito saliva. Dengue is a viral infection transmitted to human through the bite of infected mosquitoes. So the dengue virus can infect human through the bite of the female mosquito Aedes aegypti or Aedes albopictus, which can cause dengue fever. This dengue virus belongs to the genus Flavivirus and the family Flaviviridae. Next, the risk factor for the dengue virus include rainfall, temperature, humidity, and the densest human population environment. The second, which substandard housing and damage to water system, sewerage, and improper waste management. And the last one, mosquitoes control that is not implemented properly. And then combine to the topic, which are mosquitoes' habitat.
Hello, my name is Kharisma Alfiyanti and now I'm going to discuss about the next topic, which is the signs and symptoms of the disease. So, dengue hemorrhagic fever has several signs and symptoms that the sufferer will experience. There are 1. A high fever that can reach 40 degrees Celsius. 2. The body becomes lean, tired and lethargic. 3. Loss of appetite. 4. Pain in head, back and while moving the eyeball. 5. Nauseous and vomiting. 6. Sign of bleeding such as nosebleeds. And the last one is a red rash appears on the skin. Okay, maybe that's all the signs and symptoms of the dengue hemorrhagic fever. Next, my friend will tell you about the complication of the disease.
Hello everyone, my name is Nila Wahyu Saputri and my student ID is 20065988345 and I will talk about the next topic about complication of dengue fever. Severe dengue fever or untreated dengue fever can lead to serious complications such as dengue shock syndrome or DSS that can cause internal bleeding and organ damage. This condition is characterized by decreased blood pressure, wet and cold skin, irregular breath and dry mouth, weak pulse, and decreased urine volume. In this condition, blood pressure can drop to dangerous levels and causing shock. Blood flow to all the body tissues will decrease and resulting in a lack of oxygen or hypoxia. This can cause seizures, damage to the liver, heart, brain, and lungs, blood clots, and even death. So that's the discussion about the complication of dengue fever.
Assalamualaikum warahmatullahi wabarakatuh. My name is Reiza Rachmadani and I will explain about physical examination results and diagnosis of dengue fever. There are three basic diagnoses of dengue fever. The first one is anamnesis of disease, the second one is physical examination, and the third one is supporting examination. The first one is anamnesis. The classic symptoms of dengue fever are fever, skin rash, and bleeding. High fever around 39 to 14 degrees Celsius for 5 to 6 days. Skin rash, also found on the face, neck, and chest, occur on the second or the third day, and bleeding indicating that the patient is already experiencing dengue hemorrhagic fever. The second is physical examination. Physical examination depends on the severity of the disease. Here's the clinical sign of dengue. The third is supporting examination. There are several methods can be used for diagnosis of dengue fever infection. First is virus isolation methods. Various reverse transcriptase polymerase chain reaction or RT-PCR methods are available and are considered the gold standard. And the test doesn't require specialized laboratory technique or equipment. Second is using serological methods. It using enzyme-linked immunosorbent assays or ELISA. The presence of IgM is indicative of dengue fever infection. For the next topic will be explained by my friends.
Assalamualaikum warahmatullahi wabarakatuh. My name is Tiara Nurjanah and I will talk about the promotion and prevention of the dengue fever. While facing dengue fever, we need to take proactive action. There are a few actions we can do to prevent dengue fever from spreading. Promotive actions such as lectures and posting preventive actions on social media and public spaces is one of the most effective ways to start a public movement against dengue fever. Not only there are promotive actions, there are also preventive actions we can do. For example, daily house cleaning, fogging, and vaccination programs. These actions is needed because both proactive and preventive complements each other in order to guarantee a success in controlling dengue fever.
Thank you guys for watching. Hopefully it'll taught you something to prevent and deal with dengue fever. Like they all said, prevention is better than cure. So please always keep the environment clean and healthy for your living.